it looks like we lost Scott, so hopefully he can get back on, but I'll go ahead and get us started. So just I want to say thank you everyone for joining and welcome to today's webinar on the impact of COVID-19 on the construction industry and new research initiatives. Cain is here to moderate today.
So I can take it from here.
Okay, yeah, that would be. You want to go ahead and introduce our listeners? Thank you.
Okay. I'm just going to give a little bit more background. There's still a lot we don't know about the novel coronavirus and its impact on our health and industry. And in response to those questions, we at CPWR and NIOSH are tapping into our various research programs to learn more. CPWR has been tracking COVID-19's impact on construction workers and businesses, including its impact on at-risk populations. And NIOSH has established a coordinated research program to address new research needs. We have a number of new projects underway, both at NIOSH and CPWR, and one of the NIOSH research projects is looking at the use of KN95 respirators that you'll be hearing about in today's presentation. Our first presenter is Samantha Brown, a research analyst with CPWR's Data Center. After Samantha shares the latest industry trends, Dr. Samy Rengasamy, I hope I didn't hurt your name, Samy, a research physical scientist with the National Personal Protective Technology Laboratory at NIOSH CDC, will introduce his new study. I'm the executive director, and I will moderate today's webinar after presentations from each speaker and lead us through some discussion. We did receive a number of advanced questions through registration, which will be addressed first, followed by live questions as time allows. So please type your questions at any time into the Q&A box on the screen. With that, I'll hand it over to Samantha to get started.
Thank you, Chris. Okay, so hi everyone, my name is Samantha Brown. I am a research analyst with the CPWR Data Center, and today I will be sharing some of the data center's work around the impact of COVID-19 on construction workers and businesses. So as of 2020, the CPWR Data Center publishes bi-monthly data bulletins. The focus is on a variety of construction industry safety and health trends. So naturally this year we decided to focus on COVID-19 for several issues. So today I'll be giving an overview of results from our first 3 data bulletins, which are listed on the screen here. So all 3 of these data bulletins are related to COVID-19, though I should mention that at this point there is not data available showing COVID-19 case or death rates among construction workers specifically to us. So because of that, we're unfortunately not able to directly measure the impact of the pandemic on construction worker safety and health in that way. However, these data bulletins are sort of the next best thing. So we use the available data to jointly assess the health and economic impact of the pandemic on construction workers and the industry as much as possible. Okay, so starting with the first data bulletin, the focus of this bulletin was on health insurance coverage in the construction industry. It was published in April 2020, and it's not explicitly related to COVID-19, but has many implications. So the purpose of this bulletin was to examine latest trends in health insurance coverage among construction workers. To do this, we used self-reported, nationally representative household data from the annual social and economic supplement of the Current Population Survey, which is a regular survey conducted by the U.S. Census Bureau. And the reason that health insurance is relevant to COVID-19 in construction, well, there are a couple of reasons. The first is that the cost of care for COVID-19 can result in major financial issues for people who are uninsured, especially if they require extensive treatment or hospitalization. And the second reason this is important is that uninsured COVID-19 patients may be more likely to delay or forego care. So there can be financial consequences as well as health consequences for uninsured folks. So some of our key findings from this bulletin: first, we found that uninsured rates were higher among workers in the construction industry compared to workers in all industries combined. And then we found that within construction, Hispanic construction workers were more likely to be uninsured. We also found that employment-based coverage in construction was more common among white non-Hispanic workers, among workers in large establishments, and among union members. So diving into some of the specific results, we found that construction workers were twice as likely to lack health insurance as workers in all industries combined. On the left chart, you can see the uninsured rates in construction versus all industries, and you can see that the uninsured rate is consistently higher in construction over time. So in 2018, about 24% of construction workers did not have any health insurance coverage for the entire year. And the right chart shows a more detailed look at this in 2019. So at the time of the survey, about a quarter, or 25% of construction workers did not have health insurance coverage. And construction was the industry with the highest uninsured rate at the time of the 2019 survey. We also found that within construction, Hispanic workers were more than three times as likely to lack health insurance coverage as non-Hispanic white construction workers. So again, this chart shows the uninsured rate over time among construction workers. You can see that it's consistently higher for Hispanic workers, and in 2018, about half of Hispanic construction workers lacked health insurance coverage. Lastly, with this bulletin, we found that the percentage of workers with employment-based insurance increases with establishment size. So the larger a construction worker's establishment size, the more likely it is that they have employment-based health insurance coverage. Moving on to the second data bulletin, the focus of this was on the coronavirus and health disparities within the construction industry. This was published in May of this year, and the purpose was to characterize groups of construction workers that may be at higher risk for severe illness from COVID-19. So to do this, we identified and measured risk factors based on guidance available from the CDC at the time. So since the beginning of the pandemic, the CDC on their website has posted potential and confirmed risk factors for severe illness from COVID-19. These can be grouped into three categories. So the first is demographic characteristics, particularly age and race and ethnicity. So we know that the risk for severe illness from COVID-19 increases with age, and hospitalization and mortality rates from the virus are also much higher for racial and ethnic minorities compared to white non-Hispanic people. The data source we used to find demographic characteristics for the construction workforce was, again, the current population survey. And other risk factors we looked at were medical risk conditions. So these are conditions that increase clinical risk for severe illness from COVID-19. They can range from respiratory conditions like COPD to other diseases such as cancer. Finally, we looked at other risk factors. So we looked at severe obesity, current smoking, and e-cigarette use. And to find the prevalence of medical conditions and other risk factors, we used self-reported health and behavior data from the National Health Interview Survey, which is another nationally representative household survey conducted by the National Center for Health Statistics, which is part of the CDC. And our main takeaway from this bulletin was that the majority, or nearly 60% of the construction labor force, had at least one risk factor for severe illness from COVID-19. Taking a look at some of these specific risk factors, first, age, we found that on average, construction workers are older than workers in all industries combined. So in 2019, the average construction worker was 42.7 years old compared to 42.4 years old in all industries combined. And the CDC has found that risk for severe illness from COVID-19 increases incrementally with age. So even people in their 40s or 50s are much more likely to have severe illness from COVID-19 if they're exposed to the virus than people in their 20s. So these age-related trends are relevant to the working population. We also found that there are proportionally more Hispanic workers in construction compared to all industries. You can see on the right chart, this trend has been consistent over time. So In 2019, about 30% of construction workers were Hispanic compared to only 18% of workers in all industries. In the left chart, you can see that about 3.5 million construction workers were Hispanic in 2019. According to the CDC, COVID-19 hospitalization rates are 4.6 times higher in Hispanic versus non-Hispanic white people. Of course, this is due to many environmental factors such as living, work, socioeconomic, health circumstances. You may remember from the first data bulletin I just covered, Hispanic construction workers were also much less likely to have health insurance coverage. So that could be another contributor. Moving on to risky medical conditions, we found that nearly 1 in 5 construction workers had a respiratory disease and 1 in 4 had another medical risk condition. So if you look at this chart, overall, 37.7% of construction workers had at least one medical risk condition, which are listed below in the chart. So you may notice that the percentage for construction workers is slightly lower than the percentage for all industries combined, which is 42.2%. This could be due to the healthy worker effect, but it's still a pretty large percentage to consider. And again, this just shows the increased risk for severe illness if a person is exposed to the virus, but construction work is considered essential and has been since the beginning of the pandemic in many states and localities. So risk of exposure to the virus is also something else to consider. So again, our key takeaway combining all of the risk factors, risk conditions, old age, is that nearly 60% or the majority of the construction labor force had at least one risk factor for severe illness from COVID-19. The last data bulletin I'll cover has more of an economic focus. So this is titled The Impact of COVID-19 on Construction Workers and Businesses. It was published in July. And in it, we take a look at job losses, medical absences, and business conditions in construction. To do this, we used data from the current population survey, which I've mentioned. We also used some employment data from the current employment statistics from the Bureau of Labor Statistics. And lastly, we used data from the Small Business Pulse Survey, which is a new survey conducted by the U.S. Census Bureau to assess the impact of the pandemic on small businesses. And I'll talk a little more about that later. But our key findings are, first, over 1 million construction workers lost their job from March to April, and minorities were hit the hardest. Among construction workers who kept their jobs, work absences for medical reasons increased. And according to self-reported data from small businesses, small construction businesses were moderately impacted by COVID-19. This chart shows monthly trends in employment from January to June of 2020. You can see that there was a major dip in employment in construction and in all industries, and then small increases from April to June. So this is mostly in line with COVID-19 related business closures and reopenings. You can see that the pattern is pretty similar in construction compared to all industries. However, the increase from April to June in construction was higher than it was in all industries. So all employment in construction from April to June increased 14%, and in all industries, the increase was smaller. It was 7% increase. Here we see unemployment trends. So there's a major spike in unemployment in construction from March to April, when nearly 1 million construction workers became unemployed. And of these workers who became unemployed, over half, so 55%, were temporarily laid off, meaning that they expected to be recalled to their work within the next 6 months, or they were uncertain whether they would return to work within 6 months because of the coronavirus pandemic. Another thing we found was that employment drops in construction affected certain groups differently. So we found that construction employment loss was higher among Hispanic, female, Black, and self-unincorporated workers. Both of these charts here show percentage change in construction employment from March to April. So you can see overall construction employment dropped 15% during these months, but in some groups it was much higher. So for Hispanic construction workers, the drop was 20%. And we already mentioned that Hispanic workers are less likely to have health insurance coverage. They may be at higher risk of severe illness from COVID-19. So Hispanic construction workers may be a group at especially high risk in many areas during the pandemic. The right chart here shows that the employment drop among self-employed unincorporated construction workers was over 20%. So these include workers who have not established a corporation. They often operate alone, for example, freelancers, independent contractors, and independent consultants. The employment drop was greatest among this type of construction worker. And then looking at construction workers who kept their jobs, we found that that work absences due to personal medical reasons increased by 70% from March to April. So you can see that in the blue line on this graph here. And this does include medical reasons such as quarantining or self-isolating because of the virus. At the same time, we saw that the number of work absences due to vacation or personal days among construction workers, or the gray line on the graph, decreased. And the last focus area of this data bulletin was on small businesses. So this includes businesses with less than 500 employees. As I mentioned, we used the Small Business Pulse Survey to do this, which was a temporary nationally representative survey of small businesses by the U.S. Census Bureau. And according to this data from the small businesses, we found that compared to all non-farm industries, small businesses in construction were less likely to report that COVID-19 had a large negative effect, but they were more likely to report that it had a moderate negative effect. So that can be seen on this chart here. You can see the percentage of small businesses in non-farm industries reporting a large negative effect, or the orange coloring is consistently higher than it is for construction. A positive finding is that it increased overall over time, the percentage of small businesses reporting a large negative effect. And that's all I have for today. More detailed findings are available in our data bulletins. They're posted on the CPWR website. And that's all. I'm happy to answer any questions. Thank you.
All right, thank you.
Thank you, Samantha. Appreciate that update, and I just want to apologize for internet connection issues. But our next speaker is Dr. Samy Rengasamy. He's a physical scientist in the National Personal Protective Technology Laboratories at NIOSH, and he's going to talk about some of the work he's been doing on KN95 respirators. So, Dr. Rengasamy?
My name is Samy Rengasamy. I am a research physical scientist at the National Personal Protective Technology Laboratory of NIOSH in Pittsburgh. My presentation is on the respirator fit capability of non-NIOSH approved respirators. There is always a respirator shortage during pandemics. With the recent pandemic, there was a big problem with N95 availability. So, to respond to this crisis, FDA issued emergency use authorization and authorizing the use of non-NIOSH approved respirators. These respirators are okay to use, but we have to remember two things. One is the filter efficiency, and the other one is the respirator face fitting characteristics. So, if the respirators are made in other countries, there were several models from different countries, from China, from Mexico, from UK, all over the world. So all these are, they claim it is equivalent to NIOSH approved N95, but we have to know their efficiency as well as the face fitting characteristics. So even if we assume they are 95% efficient, we don't know their face fitting properties. That is the problem. Those respirators are made for the worker population in their countries and not for the US workers. So because the facial sizes are different, the non-NIOSH approved respirators may not fit well on the face of the U.S. workers. That's where we get into problem. Then we don't have any studies to look at this problem. That's why we thought we should be doing this work. One way to address this issue is to do a respirator fit capability assessment. This is an assessment. The assessment is the respirator model's ability to achieve passing face field performance, that is the fit factor or fit testing, on either the complete NIOSH bivariate panel or a specified set of the panel representing the population of respirator wearers when the wearers are properly trained and fit tested in compliance with Class 8 and Class 9 of the ANSI Z88.2 2015 standard. So there are two conditions. It should pass the fit testing, and the workers have to get the training. So these are the important things. Let's go to the next slide. The objective of the study is to assess the respirator fit capability of non-NIOSH approved respirators using the ASTM standard. It is going to be published very soon. The respirator fit capability assessment involves two steps. One is fit testing, then comes the fit capability assessment. I'm sure many of you are familiar with the fit testing. The purpose is to make sure the respirator fits well on the subject's face with minimum or no leaks. Usually, the port account and the companion measures the fit factor. It is a ratio of the concentration outside to inside of the respirator. When the subject is doing the fit test, OSHA fit testing exercises, it is a pass-fail test, and you want to get a fit factor of 100 or more for a pass. Then the respirator is expected to give a good fit on the face. And this is the bivariate panel. This panel is based on the face length and the face width. Face length ranging from 98.5 to 138.5 millimeter, and face width ranging from 120.5 to 158.5 millimeter are covered in this panel. And there are 10 cells in this panel, and the numbers are, it is all labeled, and the numbers are here 1, 2, 3, 4, and so on. And the numbers in parentheses indicate the number of subjects in each cell that they will be tested in this panel. Let me give some background. NIOSH conducted a fit capability assessment. This work was done by Ziqing Wang of our branch. And in this study, 101 models of filtering face piece respirators and elastomeric half face pieces were tested. Each model was fit tested using a 25-member bivariate panel, and the port account companion was used to measure the fit factors. And the data was analyzed for all the models, and the fit capability of NIOSH approved half face pieces were defined. So when the data was analyzed, 13 out of 25 subjects passed the fit test, for 75% of the models on the market. So NIOSH thought it would be a reasonable way to go. That's how the fit capability assessment is going to be done by ASTM as well as for the study we are planning to do. Based on the previous study, ASTM developed a respirator fit capability standard test method. And in that test method, sodium chloride aerosols will be used in a test chamber, and the port account companion will be used for measuring the fit factor. And again, the 25-member panel will be used, and the fit factor 100 or more will be a pass. And if 13 out of 25 subjects pass the fit test, then the RFC is 50% and the respirator is good for use. The current study that is for the non-NIOSH approved respirators, we are planning to do the study. We haven't determined how many models we are going to do. It is still in the planning stages. But hopefully we will be able to test some models on the market. And one of them is the KN95. And I'm sure people, you may have heard that it has some problems. So that is the concern. Yeah, some of the laboratories have found out it is not great. Even NIOSH tested those respirators and they don't meet the filter efficiency level, some of the models. And we are going to use the same bivariate panel with the 25 members, and the fit testing will be done in the sodium chloride aerosol chamber. Then we will get the RFC value, and then we will report the results to the concerned users. The next steps are to develop the protocol, study protocol. Then it is the peer review, and then IRB approval. The data collection will start in 6 to 9 months. That's all I have. Thank you. I appreciate your listening, and I would be happy to answer your questions.
All right, great. Thank you, Samy, and thank you, Sam. This is Chris again. I wanted to ask Scott Earnest if you had any other comments that you would like to make since you were having some technical difficulty at the beginning of the webinar before I get into questions.
I just want to apologize for the internet connection problems when we started up. The only thing I really had to say in terms of an update from CDC is I did want to let everybody know that CDC has updated their website on issues related to transmission of COVID. Basically, the bottom line is that the CDC still feels that the most common mode of transmission is through close contact, but they have added some language related to spread by aerosol transmission. This was just updated earlier in this week, and there may be additional revisions going forward. But that's the primary thing I wanted to mention about the update to the CDC website. That in some cases they are acknowledging and documenting some airborne transmission through aerosol. And that's all I had.
All right, thanks, Scott. So I'm going to go ahead and ask some questions of Sam and Samy. The first one is for Samantha. Do you have any data on what personal medical reasons were for the work absences you talked about, and any information on how many of those were COVID related?
Great, that's a good question. So unfortunately, we don't have access to that data. We don't have access to data that includes information on specific medical reasons resulting in work absences. So that includes work absences because of COVID-19. Sort of the most narrow we can get is knowing that work absence resulted from a medical reason. We do know that people who missed work because they were quarantining or isolating because of COVID-19 were included in the personal medical reason category, but we unfortunately, with this data source, cannot break it down any further.
All right, thank you. And for Samy, if construction companies use KN95s, is there an increased risk of encountering ineffective counterfeit products compared to N95s, for which NIOSH is monitoring the market and posting notices about counterfeits?
As I mentioned before, there are counterfeits. Even under normal conditions, there are counterfeit respirators coming on the market. But now it is a big problem with the KN95s and other similar respirators. Actually, NIOSH is trying to... Actually, NIOSH did some work on this. They got the respirators. I have it in the last slide, if you want to show that. Oh, it's here. Okay. NIOSH actually tested the non-NIOSH approved respirators. And you can go into this website and find out the models. If you are using any KN95s, you can find out the filter efficiency. NIOSH measured the filter efficiency. At least this gives an idea. Some of them are okay, but some models are very poor if you look at the numbers. So you don't want to use some very poor filtration efficiency non-NIOSH approved respirators for sure. Then the next thing is you have to worry about the face fitting, whether it is really fitting. That you have to do it. There is not much NIOSH can do at this time. But an experienced respirator user should be able to find out whether it really fits well or not. Even by doing a seal check, the first thing you want to do is a seal check before you do the fit testing. By doing the seal check, they can easily figure out whether it is really tightly closing the gaps. They can easily find out. Yeah, they should have some experience in using the respirators for a while. But at least this site shows what are the good KN95s, what are the bad ones. It gives the numbers. One thing I have to mention, this is not a complete test for N95s. It is a quick test. For NIOSH certification, the N95s go through a number of tests. But these ones, we just tested the efficiency. So, but it gives a good estimate. You can believe the efficiency, even though the other things we haven't done. And also, if you need any help with the N95, if you are worried about some non-NIOSH approved respirators, there is a way you can send them to NIOSH and we will be testing them. At least the efficiency, you can send us, but there is a website you can follow and follow the instructions. So you can supply the respirators, we will be able to give you the efficiency.
All right, thank you. Here's one for Samantha. In the last chart, what was the question asked? Does the self-reported positive, negative, or moderate effect refer to profit or ability to keep staff on or number of projects? And Jess has pulled up that slide.
Sure. So again, this, as a reminder, this chart uses data from the Small Business Pulse Survey, which was conducted by the Census Bureau to address the impact of COVID-19 on small businesses. So those are businesses with under 500 people. The question that we used for data in this chart was pretty vague. It was simply, overall, how has this business been affected by the COVID-19 pandemic? So the question didn't specify whether it was profit or other aspects of the business that were impacted. However, the survey, it does include more specific questions than this. So it does include questions on revenue, business closures, federal aid, we did summarize a few of those more detailed measures in our data bulletin, which I think Jess sent the link to everybody for that. And data on many of the survey responses can also be found on the census website for this survey. So more detailed information is available in those places.
Great, thanks, Sam. One of the questions we have is for Samy. Do you need study participants from the construction industry to participate in the project you're planning?
We welcome subjects, but the thing is, we don't know when we are going to do the testing, and they should be available at that time. And it's all just, we can accommodate some workers. It's not difficult, but we will let you know if you are really interested in participating.
Okay, great. This question just came in during the presentation, and it's for Samantha. You showed information about health insurance, but also absences on the job. And the question is, can those numbers be broken down into union versus non-union?
Yeah, so for the health insurance coverage in the first data bulletin, we did look at trends by union and non-union construction members. Union and non-union members and construction workers, and we found that insurance coverage was higher and employment-based coverage was higher in union members. We did not look at work absences by union membership, but that would be an interesting thing to look at.
All right, thanks, Samy. Or Sam. Here's a question for Samy. Are there KN95s with exhaust valves? And if yes, will you be looking at those?
Yeah, there are models with valves. We haven't placed the order for them, but we will be using both valved ones and non-valved ones, sure.
Okay, great. And for Sam, will you be evaluating the impact of colder weather and work moving indoors on the spread of coronavirus in the workplace?
So unfortunately, we're not able to measure the incidence of COVID-19 among construction workers specifically directly with the data available to us currently. So we can't really answer this question directly. We can, however, continue to look more indirectly at the impact of the pandemic on the industry. So, for example, instead of looking at whether incidence of COVID-19 increases with the colder weather, we could look at medical work absences.
Okay, thanks, Sam. And Samy, the question is, do you know if there's any effects of long-term use of face coverings or N95 masks?
I really don't know, but from the previous, people have been using these respirators in workplaces. So I don't think there is any report showing the problem with the long-term use. As long as they use it properly, they shouldn't have any problem. But that's all I can say right now. I don't want to say there is no problem or problem. Because these respirators have been in use for a long time. There is no such report as long-term use was a problem.
All right. And this one just came in for Sam. The question is, do you have any information on construction employment numbers in July and August? Did those numbers continue to go up since you did the study? Is that something that the data center's been tracking?
Yeah, that's a good question. So I don't think we've published anything related to that yet, and I'm not sure what the exact numbers are off the top of my head. But that is something we definitely we plan to continue to track.
Okay, is that something you can get an answer for that we could follow up in the post-webinar email? Is that data readily available?
Sure. Yeah.
Okay. So for the person who asked that, we'll try to track that information down and get it out to you. Here's a question. Would NIOSH consider sharing a quick guidance like fact sheets or checklists on the information presented on N95 and non-NIOSH face mask selection usage criteria for construction workers?
I'm not sure what effort is going into this, but since there is a list of respirators, non-NIOSH approved respirators tested, and the results are there, so that is one way you can see the information right there. And also, NIOSH is willing to test if you have any models that is not on the list. You can send them, and we will be able to test and give you the value, the filtration efficiency value.
Okay, great.
Chris, Chris, this is Scott. If I could weigh in, I just wanted to say that over the last several months, we have made an effort to bring in additional help to support the response on coronavirus, and so we're in the process of onboarding 40 to 50 professors through interpersonal contracts with universities primarily, and a number of these folks that are being brought on are going to be helping with the construction industry, and so we're in the process of developing additional guidance right now. So there's several checklists that have been developed, and we've shared this with our folks on our work group. We're getting input that way, and then it'll go through a clearance process. But we are having a sustained effort now with this additional staff to support work in this area to provide more guidance on some of these topics.
Thanks. I'm glad you chimed in there, Scott, because I thought that was a good question for you. There's some really interesting things coming in. One thing that came in from someone who's on our webinar is that this person is a respiratory fit tester in healthcare, and they've only been able to routinely obtain KN95 masks. This person would like to see a published guide or handout on the KN95 masks if they pass fit testing, that they are acceptable as one of the last you use to go down the respirator selection hierarchy. Just as a comment, the OSHA has put out some information on hierarchy, and I've been trying to obtain it, and we'll try to get some information a little bit further along on the selection of respirators. But the one comment I wanted to relay as well is that the same person does fit testing in healthcare, and they identified that KN95s will pass the qualitative fit test around 65% of the time. So it's just a pointer from one of our great participants on this webinar.
Yeah, it's possible. Yeah, it's possible. Some of the respirator, there are so many KN95 models. Some of them may give good face fitting for some of the workers here. So it's not anything surprising. But it all depends on what model it is and how, that's the question. If it is consistently giving a good fitting.
Great, thank you. So I think this is one for Samantha. Are there any new surveillance efforts underway to gather more specifics on how the pandemic has affected the industry?
Sure. So there are sort of two sides to this. the pandemic affects the construction industry and the health side, and so that's looking at incidence rates and mortality rates. So currently, as I've mentioned a couple times, we unfortunately don't have data on the number of COVID-19 cases or deaths in the construction industry. This is because industry and occupation information often isn't available in the current national COVID-19 surveillance data collections that are being used. So we're working with NIOSH and state occupational safety and health programs in a few ways to collect this data. So a few of these include, first, we're considering adding COVID-19 industry and occupation questions to the behavioral risk factor surveillance system, which is a large health surveillance carried out at the state level. Also considering planning a multi-state callback survey of workers with COVID-19 to collect occupational information. Also considering collecting information on occupational health-related aspect of COVID-19 through different types of surveys. And another thing we're considering is coding industry and occupation and the National Death Index so that there's a way to connect deaths related to COVID-19 to occupation and industry. So that's all related to the incidence and the mortality of COVID-19 among construction workers, which would be really valuable data for us. The other side of this question is looking at the economic impact of COVID-19. So we have measured construction employment and business performance using the data sources we have available. We plan to continue to do that. Our next data bulletin will report the effect of the pandemic on the value produced by the construction industry, which we haven't published that data bulletin yet, but that will be our next bulletin. And our new report will also include data from the second phase of the Small Business Pulse Survey conducted by the U.S. Census Bureau. So originally, I think that the data included in the Small Business Pulse Survey and the third data bulletin, which I presented, is through June. And data in the second phase of the Small Business Pulse Survey is collected from August to October. So that should give us an updated understanding of the situation.
All right, thank you, Samantha. So this is Chris. It's my turn to have technical difficulties. So I was wondering, Jessica, if you noted any other answers or questions or tips that have been shared that we should convey. If not, we're going to go ahead and wrap up.
Just one question for Samantha. Are there any plans for monitoring long-haul health effects among construction workers with COVID-19?
Yeah, I think that's a really interesting question. So beyond what I just mentioned, looking at the incidence of COVID-19 cases and mortality, I'm not aware of long-haul health effects. So maybe that's something else I can follow up on internally and email out if we have any answers.
Yeah, this is Chris. Just to add to that, I think that was a good answer, Sam. But I think that the science is still out on some of the long-term health effects, but we'll be watching and seeing if any of the national data sets that Samantha and Sue and Raina in our data center use will help us answer that question. Thank you for the question. Before my computer stopped working, I did get one question about the use of KN95s to replace N100 respirators used for traditional health hazards in construction like silica, and was able to do a quick web search of OSHA's website and found nothing on it. But I think that really is a question for OSHA, and as an industrial hygienist with great familiarity of silica, you know, I think based on what the little we know about KN95s and some of the bad information we know about them that is probably not a good idea and it might be in violation of an OSHA standard. But if we can dig up a better answer, we'll communicate it via email. And with that, I think we'll go ahead and wrap up. I wanted to thank Sam and Samy and Scott and especially Jessica for today's webinar. Really nice job. Okay, thank you very much. Have a good afternoon.